So when you look into the pathogenesis of Phakka roga, as mentioned in the shloka, it is in the shloka actually the things are not orderly mentioned. To understand this particular concept in a clear-cut way, so we have to rearrange the shlokas to some extent. Okay, so different causes we have mentioned. It may be Kshiraja, it may be Garbhaja, it may be Vyadhija, it may be Pradushta Grahani, it may be social causes, whatever the causes. What is the ultimate nutritional cause? What are the ultimate outcome? Ultimate outcome is FTT, failure to thrive like condition. Growth chart is falling down, it is flattering, and there is a condition of Phakatva. Clinical condition we have got. Now, if this particular clinical condition, if it is not treated well, then how the child attains the stage of death? So that has been explained by a series of symptoms which are explained in Vyadhija Phakka. Okay, the first phase of the pathogenesis is general debility and emaciation. If you rearrange the symptoms, then it will be clear. Okay, so I will try it. Now, general debility and emaciation, this is the first phase. First phase. Okay, so now this is a slow presentation and it may take years together. There is a spelling mistake, sorry. It may take years together. Okay. Gradually the condition becomes chronic, and at times the pathogenesis is fast depending on the cause. If the cause is too much potent, then pathogenesis may be sometime fast. Otherwise, it is a very slow process, taking years together. Whatever may be the cause, ultimately it leads to immunocompromisation, and thereafter the further progress of the same is irrespective of the causative factors. Once it reaches the stage of immunocompromisation, cause may be whatever may be the cause, then the pathology is same. The deteriorating condition, fakir nature gachati, deteriorating condition of the patient is the same for all the causes, whatever may be the cause. Okay, so first one is, he says Kshinamamsa Baladyuti. So this is the first phase. So he says Kshinamamsa Baladyutihi. So we look into that. So when he says Kshinamamsa Baladyutihi, he says that Samshushka Spik Bahu Uru Mahodara Shiro Mukaha. So there is a Kshina of the Mamsa and as well as Bala. That is body fat, muscle fat, or body fat and muscle tissues are depleted, okay, along with the strength. And very beautifully Kashyapa explains this depletion in a order. Okay, so how the muscle mass wasted, it is not randomly. One by one it is going on. So what he says, some shushka, there is kshaya of the muscle mass of the spik, bahu, uru, mahodara, shiro and mukha. There is loss of body fat, protein and carbohydrate, and caloric insufficiency will be there, just like a PM like conditions. But the order he mentioned, how the kshaya occur, that is very typical. That is very typical. In the old contemporary books, pediatrics books, we find a classification called as Acharya's grading of PM. Acharya's grading of PM. That was used clinically. Nowadays we have got WHO grading system, IAP grading system, etc. for the PM. But in olden days, actually this was used, Acharya's grading system of PM. Okay. So where he says grade 1 means loss of muscle mass from the axilla and groin. Kashyapa says bahu, some shushka spik bahu. Okay, first there is loss of triceps thickness, biceps thickness, etc. Second grade, he says that gluteal region. Next, there is loss of muscle from the muscle and fat from the gluteal region. So that is explained bahu uru. That means thigh region. Okay. Then comes third is abdomen and chest region. And Kashyapa says udara, mahodaraha. And last one, there is loss of buccal fat. And Kashyapa says shiromukhaha. Buccal fat, facial area. See, this order is almost all same. Order is almost all same as mentioned in the Acharya's criteria. Okay. So anyway, nowadays mostly it is not followed. Acharya's criteria is not followed. We have got other criteria to be followed. And now, but the Kashyapa's explanation almost all matches with the explanation of Acharya's criteria. Okay. So, but of course, this looks like a PM like condition, but don't confuse the PM. Now we are dealing with a PM is already over. Because of PM, we have got immunocompromised state, and now the progression is going on. Pathology is going on. Okay. So this is one point I want to make clear. Now coming to the second phase. In the second phase, actually what we have got is, first is all the emaciation taking place. Okay, there is loss of body tissues, there is loss of body fat, loss of body muscles, etc. Once this is over, then there is a state of deficiency. Lot of deficiency symptoms will be seen. So that is mentioned as a pitaksho. That is pitaksho, that is white looking or pale looking, the conjunctiva, eye, etc., suggesting vitamin and mineral deficiencies. Okay, whole body is pale, maybe RBC is not formed. For the formation of the RBC we require iron and so many other things. So that's one thing. Okay, then Hrishitangasya. Hrishitangasya means there is horripilation in the hair roots and hair follicles. So that actually suggests the protein deficiency, because the hair is also made up of keratin-like protein, and when keratin-like proteins are not available, because protein has been lost now continuously because of body tissue loss and muscle tissue loss, so that indicates some of the protein deficiency symptoms. Okay, now fat is not there, and fat is also not tolerated by the baby, fat is not there, then fat soluble vitamin deficiency also occur. Okay, then he says Drishyamana Asti Panjaraha. Drishyamana Asti Panjara, total loss of subcutaneous fats. Okay, because first thing which goes is subcutaneous fat, then goes when there is carbohydrate loss, this will be followed by the subcutaneous fat loss, then the protein loss will be there. Okay, so when this fat and as well protein loss starts, then the patient will appear and say Drishyamana Asti Panjara. Everything has been lost, only the skeleton is there, covered by the skin, that's all. That too loose skin, wrinkled skin. So this is considered as the second phase of deficiency. Now we come to the beginning of the Phakka stage. Okay, so first stage is stage of emaciation, second stage of deficiency, the third stage is stage of beginning of the Phakka stage or Phakka stage. So stage of disability. Phakka is nothing but a disability-like condition. Child is crippling, child is not able to stand, move, walk. Okay, crippling and continuously deteriorating, crippling down. Okay. So this is mentioned by some of the words, Pramlano Adakayascha. That means word meaning of Phakka is crippling and not able to sit and stand and walk. So that is exactly mentioned, Pramlano Adakayascha. Because of extensive pathology which is going on, there is so many neuronal damage, deficiency symptoms like vitamin D, etc. And there will be weakness of the lower limbs, and either the child is not able to walk, and that is mentioned as Pramlano Adakayascha. Okay, so there is a disturbance in the day-to-day activities also. He cannot walk and do the activities as far as the will of the child. So there may be some of the skeletal problems also. We know that the rickets and all its other consequences and all. Then child slowly start crippling instead of walking. So there is delayed development of motor milestones, and developmental milestones are delayed and not achieved.
So it's the regression.
Yeah, just like a regression, there is also regression. Now come to the next phase of Phakka Roga. So that is Phakkatva stage. First is beginning of the Phakka. Now come to the Phakkatva stage. That is the stage of locomotor disability. Okay, अब क्या होगा कि locomotor disability आ जाएगा. धीरे धीरे मसल मास चला गया, फैट चला गया, मसल चला गया, डेफिशिएंसी आ गया, ठीक है, एंड डेफिशिएंसी की वजह से न्यूरल डैमेज हो गया, बोन डैमेज हो गया. नाउ कम टू द नेक्स्ट फेज, stage of locomotor disability. Child is not able to walk now, and that is mentioned here. Nicheshta adakayo va pani janu gamopi vaha daurbalyat mandacheshtasya mandatvat paribhutakaha. Okay, so gradually there will be complete loss of lower limb functions. Okay, see why this is happening? Because pathology is progressing. There is continuous neuronal damage because there is no nutrition. No, okay, there is deficiency symptoms, neuronal symptoms, bone symptoms, everything is coming. Because of that, now in the beginning, what happens? Lower limb functions now stop. Disability is there. Okay, so nicheshta adakayova. So there is lack of interest in the surrounding. Daurbalyad manda cheshtascha. Manda chesta. So child is not much active. Manda chesta is there. Mandatvat paribhutaka. So child is dull. Delayed perception of the sensory stimulus. Now, when I say child is not interested in the surrounding, that means that the sensory stimulation is not good. Child is not responding to the environmental changes or effects, or somebody is talking. Socially, child is not interacting. Okay, so lack of interest in the surrounding. This is because of extensive neuronal damage. Okay, because of the neuronal damage, so the child is now gradually getting into the stage of coma or semi-coma, delirium-like conditions. Okay, child is dull and delayed perception of the sensory stimulus. Now, at this particular point of time, the child has crossed the stage of marasmus and now landed up in the last stage of kwashiorkor. You find similar symptoms in the kwashiorkor also, last stage of the kwashiorkor, which is evidenced by the change in the psychological and emotional changes. Okay, now come to the next, that is continuation of the Phakkatva stage. Sensory loss. Okay, now so far motor loss is there. Now child comes with the sensory loss. What? Makshika krimikitanam gamya asanna mrutyurukuh vishirna hrishtharomacha sabdaroma mahanakaha. Completely child is disabled and there is hampering of all the movements and confined to the bed. And he cannot take care of himself. Now if some krimi, kita, etc. insects coming and sitting over the skin, child is not in a position to appreciate it. बच्चा जो है उसको भगाने का कोई कोशिश नहीं करेगा. इसका मतलब एक तो स्ट्रेंथ नहीं है और दूसरा उसको वो बैठा है वो सेंसेशन ही नहीं हो रहा है उसको. ठीक है, माइक्रो एंड मैक्रो ऑर्गेनिजम्स विल बी अट्रैक्टेड and the chance of infection is more, and child is not doing an effort to remove the cause. So sensory perception of touch, cold, pressure, etc. is now completely get lost. Completely lost. Now we go to the further stage. What is that? A continuation of the Phakkatva stage. Now in this stage, now we go to the last stage where cellular catabolism and dysfunction of the autonomic nervous system starts. Okay, so Nitya Mutra Purishakrita. Child is now producing excess amount of the Mutra and also Mala. It's passing himself. That means involuntarily it is passing. Bahubojinam Bhuktam Tesham Apartakam already we have seen. Bahumutra Purishinaha. Ati Vinmutra Dushika Singhanaka Malodbhavaha. That means there is loss of bladder control, indicating the autonomic nervous function has been lost. There is loss of sphincter control, again autonomic function. There is more catabolism and no anabolism at all, because dhatu malas are formed more, isn't it? Mutra is formed more, Purisha is formed more, Singhanaka mala, that is dhatu mala, that is also formed more. So what it suggests, cellular catabolism is taking place and there is no anabolism at all. So formation of both ahara mala and dhatu mala is in excess, suggesting excess catabolic activity in the body, and anabolic activity is almost all zero. Okay, so that leads to Vishirna Hrishtharoma, Stabdaroma, Mahanaka, etc. In the contemporary sense, there is the expression of Bohr's appearance of the hats. Okay, so जो hats जो एकदम straight हो जाते हैं, ठीक है, छोटा हो जाता है और straight हो जाता है, so that's called as Bohr's appearance of the hats. So that is Vishirna Hrishtharomacha. Okay, now again Durgandhi, Malina, Krodhi, Singhanaka, Malodbhavaha. So now child is irritable now. Okay, child is outbursting the bad smell because of dhatu malas are more. Okay, Malina, Krodhi, irritable. And then lastly, Singhanaka Malodbhava, excess production of the dhatu malas. Now we come to the last stage of the Phakka, that is Phakka Shwasa, stage of Phakka Shwasa. Okay, Kshiyate Mriyate Vapi Safakko Phakka Shwasati Tamyati. Now child is almost all in the death-like condition. There is no motor movement, there is no sensory movement, autonomic functions gone, and all the body fat and body muscle tissues are lost. Okay, only catabolism is going on, there is no anabolism. Now he says that Kshiyate Mriyate Vapi Safakko Phakka Shwasati. And now there is an appearance of a Phakka Shwasa. What do you mean by Phakka Shwasa? Phakka Shwasa means a strainful or effortful respiratory movement where expiration is more longer and inspiration is shorter. Okay, so this leads to respiratory failure due to extensive loss of the respiratory muscles. So there will be dyspnea, there will be intercostal recessions, retractions of the chest, etc. And there may be also grunting. Okay, and this situation has been called as Phakka Shwasa. This is a type of dyspnea. Okay, this is a type of dyspnea or Shwasa only, considered Phakka Shwasa, that is happening because of the extensive pathologies related. Okay, now this is a situation which requires emergency condition or emergency treatment is required and resuscitation of the child should be done. The last stage that is called as end stage. Phakka Shwasa is over. Now end stage. Okay, so end stage of the disease, last point, that is a stage of deep coma or death. Okay, so what he says, Tamyati, Phakka Shwasati Tamyati. Tamyati means tama. Tama means blackishness. Or you can say, now this is the stage where the child is totally unconsciousness. Child is totally unconscious. Phakka shwasati tamyati. Tamyati, tamapravesha tamyati. Okay, so this is further leads to tamyati due to loss of consciousness, because the respiration is now undergoing failure. Respiratory failure is there. Child is not able to respirate, and as a result, there is no oxygen supply. The metabolic waste are not given outside. Okay, everything is collected. There is metabolic acidosis happening. Okay, meantime there is no oxygenation inside, and the nerve cells badly suffer. Ultimately, it leads to the stage of unconsciousness. Okay, and that is the end of the patient. Loss of consciousness and the end of the child with the death. So this is all about the pathology of the Phakka roga. First we have seen the cause, and then we have seen the step-by-step pathology of the failure to thrive when it is going to the death-like conditions. The same is considered as a Phakka roga in case of Ayurveda. So that's all. Thank you very much. Okay. In the next class we will see the treatment of a Phakka roga. Thank you.